Good morning. I just wanted to talk briefly and give you a commentary on our recently accepted manuscript in the Journal of Robotic Surgery on maximal urethral length preservation and maintenance of penile length post-radical prostatectomy. We first published our data on maximal urethral length preservation, or MULP, M-U-L-P, as I like to call it, in 2014. We found it as an easily reproducible technique of preserving intra-prostatic urethral length, which in the long term turned out to be one of the factors in very early return of continence in patients post-robotic radical prostatectomy. We then started looking at other factors which are important in patient satisfaction post-robotic radical prostatectomy. Continence was an important factor. Preservation of erectile function was an important factor. But at the same time, there was some dissatisfaction in the perceived length of the penis. This has been over and over discussed at various forums and various journals, that there is a shortening of penile length, or the perceived penile length, and the anatomical actual penile length in patients post-radical prostatectomy. So we started looking at our data, and we prospectively went ahead and did a study in which we measured the stretched flaccid penile length in patients before and after robotic radical prostatectomy. Now, we didn't have a control group in this case because all our patients undergo maximal urethral length preservation. So this was more like studying our outcomes. And what we found was that maximal urethral length preservation actually preserves penile length, or the stretched flaccid penile length, in the majority of our patients. This was statistically significant and was a game changer. We did find that multipanometric 3T MRI prior to surgery helped us in getting the maximal urethral length, so that since we had a roadmap as to where the cancer was present. So we were very happy to present our data and state that maximal urethral length preservation, amongst the gamut of different techniques which have been used to preserve continence and return of early continence, this is the only technique which, besides leading to early return of continence, is also preserving penile length, which is a major source of satisfaction in patients undergoing robotic radical prostatectomy. Thank you.